Thank you for being here. Thank you for sticking around, even though lunch is on the other side of this presentation. I have been so excited listening to these other speakers and hearing about these common threads that we have, the training that we've all been doing, the reading, the becoming acclimated to the space. And so while I have a lot of those lessons and those stories in common, I'm going to talk a little bit about how my experiences, my unique experiences in my career and in my grassroots work have really helped me to identify a set of skills that perhaps can help all of you also identify, here are some tangible things that we can do. We've heard these calls to action, and I'm going to talk through what can that action look like in the particular things that you do and that you hone within your own work. So, as she said, my name is Lindsay Yerger. I used to work for USP, US Pharmacopoeia, until last fall. And this is an organization that most people have never heard of. It's not part of the government. It is a nonprofit, and it is tasked with setting medicine quality standards. And what that means is they pull together scientific expertise from all sorts of different disciplines, from pharmacists and physicians and regulators, to say when we talk about a particular medicine, like if we say acetaminophen, we mean this chemical. When it is this strong, it is not more strong, it is not weaker, it is exactly that amount, and it doesn't have a whole lot of impurities, the unwanted bad things. And so that's really at the crux of what USP does. They've been doing this for over 200 years. They predate FDA. And so in my work at USP, I got to work with a lot of experts about a lot of interesting things. I'm also going to talk through, with these different skills, three main ones. Connecting. So it's interesting what Avery did, and that's one of the roles. I'm definitely a connector. Being a connector. The second one is being decisive. And then the third is trusting my teams. So I'm going to tell you about those things along the way, and keep an ear out. So as you're hearing those stories and those examples, if something makes sense to you, or if it's a gap, something that you do not have and you want to develop, think about those examples and where you might be able to develop there as well. So the key one, and it was mentioned in the intro and the bio, is going back 5 years. It's the start of 2021. We're in the thick of it with the pandemic, and the first vaccines haven't even been released yet. And I was appointed with leading a task force to increase global access to safe, quality COVID vaccines. And that was an insane thing to ask of a person. And I was like, I'm not part of the government, I'm not in WHO or the UN. Surely there must be somebody who can step forward and do that work. Why me? Who am I to do all of that? But whatever combination of fate and circumstance, I did have a unique skill set that I was able to put into practice in connecting that team of experts and not just saying, here's what good can look like, but getting that information out into the world. And so being a connector isn't just saying, okay, we have this worksheet. These are the ways to get more doses out of every vial. That's great. How do we get it out into the hands of pharmacists? And so those best practices were implemented in the US vaccination rollout. I didn't know this person. The person I'm working with, the expert, didn't know this person, but we pushed to say, that person exists. Who are they? And let's talk to them. And then when I got to talk to them, I had to be decisive as a leader. I couldn't just treat it as, let me tell you all the things that I know so that now you know them, and now then you can think the way that I think, and then you'll do what I think you should do. Like, that's not the role of a connector. It was giving them the information that they needed and that mattered to them in that context, and being savvy to that. And it wasn't something that I just came out of college knowing and that I knew after a year in my field. It's developed over time. And I had for a long time not valued that skill set and how distinct and unique and impactful it is. And so I learned connecting isn't just flinging people at the right other people, it's coaching along. Here's what you can do to be effective with them. This is the right person because they have a connection here. Don't waste their time on this other thing. That's not relevant for them. They need this. And so, for example, my team of experts had run experiments when those first vaccines were released, that you could withdraw 8 to 10 doses out of every vial. And they figured out the right combination of needles and syringes to get that 10th dose out of every vial. And we're talking at a time when the mortality rates were sky high. We're talking about a time when infection rates were insane. And so getting that information out, not just with that US rollout, but then talking with states like Alaska under State Board of Health, where I could say, how are you going to serve your indigenous populations with this information? I had a proximity to power, and I had actual power that I was able to leverage in that moment. And I had to be decisive with that. It wasn't, here's everything I want you to adopt. It was, I'm going to push, like, I can't remember if it was Jasmine or Amanda, in a sniper way. I'm not trying to just shotgun everything. And so it was interesting as I was going about this work and I was getting these results, and I was having the opportunity with the team connecting with the Prime Minister of India to say, okay, here are the 3 things I would recommend, but if I could only have one, it's this. They're disposing a vaccine after just 4 hours of transport when it's perfectly good for 6. They're wasting thousands of units of vaccine every single day. And so I kept it clear and direct, I was decisive, and that helped. And of those recommendations, he did implement that one. That very day, the Minister of Health in India rolled out that message and they modified their practice. So immediately, that same day, people were getting vaccinated. Lives were being saved immediately. Something that I really had to embody and demonstrate to my team, because I trusted them. I trusted the information they were giving me. I trusted their expertise, their judgment. But I had to coach them that even if we don't know what the next step comes after this, we will find a way when it comes. We don't know what the next problem will be until it emerges, but we have to trust that we are capable and we are resilient and connected and intelligent, and when those things come, we will navigate them. And for a team of scientists, sometimes that was very hard. They wanted to be very much in that analytical space. They wanted to get more information, do more analysis. And I had to push them that I said the cost of inaction is too high. Imperfect action is better than no action. Now, in a case like that, with the vaccinations, the trade-offs, were so explicit. And so knowing, all right, holding it because we want maybe the latest update on the latest vaccine revision because now they have a slightly different color cap. Let's wait on getting that worksheet out. It's not worth it versus just getting it out. We can revise it. We will keep revising it. And they would say, well, it takes so long. I don't know how that will happen. I said, well, if it takes too long, the system sucks and we're going to change it. And it was having that assertiveness and using, again, that power, that proximity to power. Now, one of the ways that I learned to do things like that was in the grassroots work that I had done in the years leading up to the pandemic. A group of colleagues and I went to an International Women's Day workshop here in DC, and we were inspired and activated, and we were so jazzed up to go and make things better at work. And when we went back to work and we said we want to form this network, one of the first questions, understandably, was, well, what is it we're trying to accomplish? What do we want to do? We have all of these different ideas. And I said, well, it's well and good that we have ideas at this table, and it is a diverse group of us here, but we can't presume to speak for all of the women at our organization of over 1,000 people. And so we surveyed them, and we held workshops and working groups, discussion sessions, and again, had all sorts of information that we then had to boil down and make some decisions about. And it was, okay, they consistently want these top few things, and we can push for a couple of them. So the first one was paid parental leave. We fought for and we got that for our staff, for all staff, men and women, that they had paid parental leave. That was such a huge first win. And the next thing that people wanted was mentoring. And so we put together a mentoring program. I coached the sub-team for that one. The team was led by a woman named Monica, and she pulled together with a group. They researched platforms and best practices and what should the norms and the rules be, how do you make pairings. And there were times that she would talk to me as the advisor for this group, and she would say, well, who am I to make these recommendations? I'm just a scientist who's part of the women's network, but I don't have an expertise in this. And I said, well, we talked to HR. We went to them and they said, yeah, everyone's been asking for mentoring, but we don't have the time or resources. And so we said, okay, fine, we'll do it. We'll let you know how it goes. And I told Monica, look, even if there's somebody with more expertise, more qualified, more experience, you're the one here volunteering to do the work. And I believe in you. You are a capable, wonderful, intelligent person. And even if we get pushed back on different things, this is where I, as a white woman, could lend my power to back her up as a Black woman, taking those recommendations to HR, having to face being shut down by a white woman and a white man, and where I interrupted that and I said, this is unacceptable and we're going to do it anyway. And those were times where my voice was quavering too, but I still did it. I stepped into those moments where I had the need and the opportunity. And so that practice developed over all those different years. I applied it in the COVID work. I also applied it in work with our Black employee group. We had a staff survey where white staff reported that they felt like they were allies. They felt, I care about my colleagues of color and I'm an ally. The colleagues of color reported, I do not have allies at work. And the gap between those things was like 40%. Self-reporting, I'm one of the good ones. And the people of color saying, I don't know, good ones who? Where are they? They're hiding, I don't know. And so I reached out to the Black group and I said, what can I do? What do you need me to do? And it was a difficult position because I didn't want to presume that I knew what they needed, but I didn't want to put that burden on them to have to solve it all and figure it out. And so then we developed this partnership and we put together a 10-week allyship course and we developed the curriculum together. And we worked with people who volunteered to sign up for this course. And it was a lot of care put into it, but also for me, it was a big experience of stepping into that unknown, knowing I would make mistakes, but also feeling and believing and acting that imperfect action was better than no action. We get pushback for the pussy hats, and the pushback on the blueberries is valid, but if we stopped there because somebody told us that was a bad idea, well then that's shitty, and let's not do that. If somebody tells us this isn't enough, then listen and then do more. But the fact that you did something and you got criticism for it isn't enough reason to not do something. That was poorly said, but anyway. I learned through these experiences, and I learned how to be that accomplice, that person who steps up, who speaks out, and who is conveying to others that we can affect this change. We can make a difference. And also understanding my unique role as a white woman, understanding my role as a bisexual woman who was in a heterosexual marriage at that point. I was wearing multiple layers, like our other speakers have talked about, and where that intersectionality really does come to play, and recognizing where I had privilege that maybe I was hiding behind, being honest and open with myself about that, and continuously challenging myself of where is there a need that I need to step into, and also where do I have skills that maybe I'm undervaluing, but that are essential to advance the work in a way no one else can. And so again, being a connector, giving each other the means, the context, the understanding of not just who to work with, but how and to what end. Being decisive. There's a whole universe of things we could be doing, and it could be to such an extent we get stuck and we don't act. So boil it to those one or two things. And then again, trusting my teams, trusting that they will find a way, we will find a way. They're capable, they're resilient, they can handle hard things, they can handle setbacks. And so I hope some of that resonates for you all. If you are a leader yourself in any kind of element in this movement, please pay attention with your teams. Look for their skills as well. Activate their skills. Tell them you are uniquely good at this thing. Anybody could do this, but you do it in a way that really shines. This is a good fit for you. For someone else, be honest and say there's a gap. I know you want to do this, but you're not there yet. Here's how you fill that gap. Here's how I'll coach you through it. But give them those tools as well. and in addition to doing that own self-reflection. But again, I hope this gives you some ideas. It helps give you real concrete examples of how these things play out in action and have an outsized impact. So, thank you, everyone.